Good morning, everyone. I'm glad you're here, as I do have to remind some audiences in Florida, a rainy day in our state is better than most days in any other state. And I'm particularly appreciative of the topic of this conference, really thinking about healthcare affordability. And I'm going to take a bit of a different approach from some of the conversations that you've been having already to emphasize the broader context. First, I want to share with you three key numbers that matter to Florida's families. And we know that they matter to Florida's families because everywhere we go around the state, we hear Florida's families articulate they need good jobs, good education, and a good quality of life. Well, what do these numbers represent? 6.2% is our state's unemployment rate, a dramatic 5% absolute reduction since 2010, the lowest unemployment rate we've had in the state since 2008. This means Florida's families are finding jobs. 6, we have moved from number 11 to number 6 in quality of education based on a survey in Education Week published this month. And 94 million visitors to our state in 2013, the largest number on record. And when you think about visitors to a state, it's a surrogate for quality of life because no one's going to visit your state if they're concerned about what they're going to find when they show up. And what I believe that these three numbers emphasize is that good health starts with good jobs, a good education, and a good quality of life. It's very hard to have other conversations when people are struggling to find jobs, when they're concerned about the future for their kids, and when they just don't like their general existence. Florida is clearly moving forward thanks to the leadership of our Governor Rick Scott and the legislature and many of your organizations represented in this room. Well, let's look at the market for health in the state. We have 19.5 million people. We are the third most populous state in the nation, having just eclipsed New York. We have the largest percentage of seniors of any state in the population, and by 2020, we will be at 20% of our population 65 and over. We have a sizable number of children, over 20%, and if you take 94 million visitors and stretch that over a year, on any given day, we have 1.7 million visitors in our state, and that needs to factor into how we think about population health. We have diversity reflected in ethnicity and race, and as you know, we have a challenge with the uninsured. But further, we have a bit of a challenge with where people live. Here you see a satellite photo of the great state of Florida at night, and recognize that the bright lights show where 90% of Floridians live. The dark areas show where 10% of Floridians live, and that is an important consideration as we reflect on how to provide access to all people in Florida. What are the outcomes right now for health in our state? A good way to look at that is life expectancy. And at birth, the life expectancy in Florida is just shy of 80 years. It's a little bit higher than the national average. When somebody reaches age 65, they gain 19 additional years. So now their life expectancy is 84. And when they reach 75, they get another 12 years. So now life expectancy is 87. These are relevant when you think about our population demographics and the realities of how some of our threats to health could ultimately impact this ultimate expression of health, life expectancy. And in addition to all of those numbers for how we're doing with jobs and education and quality of life, what the market for health is, and how we're doing in life expectancy, we are growing just like every other state in the nation. We're growing individually like this. We are expanding. And that leads to the agenda for the next few moments that I'll share with you. We're going to talk about the weight challenge in Florida. We're going to review 5 environments that shape health choices, and then reflect on how we can reshape environments for healthier choices. Here is where we stand with weight, and recognize that we are a bit under the national average when it comes to overweight and obesity, reflected on the left side of the screen. Similarly, we are under the national average for overweight and obese adolescents. And then look at healthy weight and recognize that we are above the national average in healthy weight. And so healthy weight reflects those people who are neither obese nor overweight. And one of the areas that we are working on is getting a different mindset in the approach to the problem. More on that shortly. When we think about health inequity, we have to acknowledge that with weight challenge, there are disparities with race and ethnicity reflected here on this slide. But the other message here is that this is a problem for everyone. That is a key takeaway as we move forward to finding solutions. We got energized in the Department of Health for this issue with an environmental scan that started in 2012. We wanted to look at where the major threats were for our state, what was going to blight our otherwise bright future. And the report, F as in Fat, came out. And F as in Fat highlighted the national challenge with weight, and highlighted issues state by state. And what really caught my attention were the following trends. As things were, by 2030, almost 2/3 of Florida adults would be obese. And what scared me more on current trends, by 2030, 6 out of 10 babies born today would be obese or overweight before graduating from high school. Think about that graduation picture for a moment and recognize what that means for individuals, families, businesses, and our economy in the state. That is a major workforce challenge. And just to manage 4 complications from weight challenge alone, heart disease, hypertension, type 2 diabetes, and arthritis, just 4, $34 billion conservatively over the 17 years following this report. And to put that in a different context, $34 billion is about half a state budget. We have the lowest per capita taxes of any state in the nation. What we can spend in one area, we cannot spend in another area. And so what gets crowded out? We should be concerned about education, transportation, environmental enrichment. You all can recognize there's a whole laundry list of things that won't happen when we have to spend money for consequences of weight challenge. This takes a toll in the workplace, and many of you all are familiar with some of these statistics. On average, across the United States, those with weight challenge have 7 more sick days than those without, and that amounts to over $6 billion in costs related to absenteeism. The workers' compensation claims are doubled for those with weight challenge. And we have this issue of presenteeism, which means you show up to work, but you're really not feeling well, and so you're not as productive. And the cost of presenteeism across those with weight challenge is over $500 per employee. And that compounds in a very unhealthy way when it comes to competitiveness and business's bottom line. Well, how is it that we got to this weight challenge? It's a sum of seemingly small choices over time. It's really a matter of behavior to great extent. It doesn't take away from the reality that there are some, particularly at the extreme of weight challenge, who have a medical issue that is a bit different from some of the other behavioral characteristics we'll talk about. But the reality is that for the vast majority of the population, the challenge with weight is the product of choice. Think about where we were 30 years ago. The obesity rate in the United States was 12%. What did we do over the past 3 decades? We pretty much have said, you're fat, eat less, and exercise more. And we've tripled the obesity rate. In the United States, it's now 36%. So I suggest that that particular type of messaging or that strategy is really not working, and we need to get back to something more fundamental. Let's think about determinants of health. How is it that we ultimately feel our best absent disease? Well, this graph nicely captures a reality that the majority of health is determined not by healthcare. It is determined by behavioral patterns, social circumstances, environments. And when it comes to genetics, most of the issue with genetics relates to choices that we make that allow various genes to express themselves in unhealthy ways. So as I would sum this up, I would say that realistically, clearly over 60% of health is determined by factors other than healthcare. And perhaps one reason why we are not succeeding with our weight challenge reduction is that we are using the wrong tool. We are continuing to appeal to the 10% solution, healthcare, and as a consequence, things get really, really expensive. And we have this American mentality. Doc, can you prescribe something for this? We want the pill. We want the one thing we need to do right now that's going to make it all go away, when the reality is we got to weight challenge through the sum of small choices over decades. Again, think back 30 years. We didn't see a lot of people who were overweight and obese. Now it's commonplace because 2/3 of America is overweight and obese. You know, what happened? Did the human condition change acutely? Are we dealing with some massive infection that has allowed this to persist? No, I would suggest we're dealing with the sum of behaviors, and this really gets at what health and public health is all about: informing adults, kids, and families about how to make good choices for what they eat and how they're active in life. The Institute of Medicine in May 2012 released Accelerating Progress in Obesity Prevention, which really put a spotlight on the reality I've been sharing with you. It's going to be less about the human condition and more about the environments in which we live if we want to succeed in addressing the weight challenge. And the 5 key environments that shape our behaviors are environments in our schools, in the workplace, in food and beverage establishments, in physical activity settings, and with messages. What we in the department have done is to recognize that the solution to the top public health threat to our future, which is weight challenge, the solution has to be different. This is really not a health care issue. This is a health issue. And what that means is that we have a responsibility to figure out how to consistently get the message out for more informed, healthy choices, and how we can work with partners to turn this around and reshape environments. So we've embraced a social innovation framework. This came out of work at Stanford University. It has seen some success in schools in Ohio. And here's what it involves. There's no rocket science here. It basically says, bring together public and private stakeholders, build collaboration, and promote local efforts. Keep it local if you want to reshape environments. So this is not a top-down approach. This is not about regulating carbonated sugary beverages or taxing things. Those are New York solutions. Those are not Florida solutions. Here we want to empower people in their communities to find solutions for themselves that involve reshaping 5 environments. And thus we've launched Healthiest Weight Florida. It's pretty simple. It's very colorful because that's how we are in the great state of Florida. And it is working to tap into collaborations with other state agencies, with local governments, with businesses and chambers, with schools, with the faith-based community, not-for-profits. The list can go on and on. Anybody committed to helping Florida's kids, adults, and families make more informed choices about what they eat and how they're active in life. The 5 environments, again, that we need to reshape. I emphasize this because there is not just one focus area that's going to get us where we need to be. If all we did was to focus on the workplace and we forgot the other environments, chances are pretty good we're not going to succeed. So the business community needs to be engaged and energized to reshape all 5 of these environments, not just the environment in the workplace. Let's look at some things that are happening around our state across those 5 environments. In schools, thankfully, the legislature has put school breakfast and lunch into the Department of Agriculture. You had Commissioner Putnam here last night, and under his leadership, Florida's kids are now getting fresh from Florida fruits for breakfast and fresh from Florida vegetables for lunch. Seems like a small thing. There's nothing small at all about it when you realize that the vast majority of Florida kids get their breakfast and lunch during the week at school, and importantly, we're all paying for it. So we ought to look carefully at what we are feeding kids and recognize that what we're feeding them can result in either better outcomes for their health into the future or lesser outcomes. We're thinking about breakfast and lunch as education opportunities. In most school districts, breakfast is 30 minutes, lunch is 30 minutes. I've actually gone into some schools and just watched kids at breakfast and lunch. It is a fascinating experience, actually, and you can learn a lot. And what I recognized is that we were missing education opportunities. Why not a 2-minute video blurb or 2-minute coaching session about how to prepare fresh from Florida fruits and vegetables, or how to be more active in life? Healthy living curriculum, about half of our schools have PE, and we recognize and respect that in Florida, the curricula are owned by school districts and school superintendents, supervised by Department of Education. So we're not talking about major curricular reform, but we are suggesting that in schools that are interested, perhaps shifting from PE to healthy living as the course would be a way to integrate in physical activities that are more accessible to all kids, and community gardens, and nutrition tips, and 4-H, and you can see how this can expand very nicely. In the workplace, how many are familiar with this picture? So I'm familiar with this picture. What you're going to hear from me is a lot of realism. This is from the State Health Office in Tallahassee. Okay, so do we have challenges? Yes. Do I know why we have snack machines and soda machines in the department? I do. You in business community know why you have those as well. They do generate revenue. But the reality is we're moving from having access to that to emphasizing, prepare your lunch, bring it in. And importantly, think about fresh foods and think about water instead of sugary beverages. We've implemented a program where we're bringing in standing desks. This is very cost effective. You do burn energy when you stand as opposed to sit. You promote healthier behaviors when you stand as opposed to sit. And we're not doing the treadmills, which are out there, and that's candidly because of cost. But the other thing is when you start really talking to people about treadmills, you do hear a lot of stories about, we have the treadmill desk and it looks good. People aren't using it. So turns out a standing desk leaves nobody the option of not using it because that's your desk. It's done by volunteers, by the way. I want to emphasize that. And further, I emphasize that we need to walk during breaks, and we can have walking meetings as well. I do walking meetings with 1 or 2 people. We've got a very nice campus, and it's a way just to integrate energy-burning activities into the regular day. Now, you're familiar with some of the statistics about wellness programs that are highlighted here. A very holistic wellness program that thinks about the workspace, food and beverage choices, physical setting, etc., can produce significant savings to the point where every dollar spent on a wellness program saves $5.50 in cost. What about food and beverage? Well, we've had some success in the state and across the nation with getting calories on menus so that people think that when they're making a purchase, it's not just the dollars, it's calories consumed. Menu options, a lot of success here in Orlando with putting a spotlight on restaurants that have healthy menu options. And we're working with Commissioner Putnam again in bringing fresh fruits and vegetables into communities. A lot of talk about food deserts, and the reality is that as we wait to make it attractive for the private sector to move into communities, why can't we make farmers markets mobile to go into communities? Why do we expect people to take time out of their work to go to a farmer's market that's inconveniently located? I think I've captured what happens far too often in communities. Let's put farmers markets where the people are. Physical settings, this is a map of the State Health Office in Tallahassee, and what we've done is to map out walking routes as a way to encourage people to walk during breaks, but importantly, we're maintaining these routes. And that's an important message for business. It's one thing to have a trail or path, it's quite another to make sure it's safe and attractive so that people actually want to use it. Messages, 3 key elements here. Words matter, goals matter, and realism matters. And I'm going to use healthy weight as the example. We're not calling it lose weight, we're calling it healthy weight, because people aspire to a positive goal. Think about it for a moment and realize that when you often hear, don't do this, don't do that, there's something that happens in your brain that, 1, makes that seem more difficult, and 2, it almost sends the reverse message, because you don't hear the don't, you hear the that. The second issue relates to goals. People like scores. We're about to have a big game in the state on Sunday. And imagine the Super Bowl without a score. Really. And far too often we've got programs out there that do just that. They spend a lot of money and there's no score and you don't know how you're doing. People individually, as families, in organizations, and as states need to have clear goals in mind. And the realism, what you will hear me talk about, are messages that understand the human condition and that don't set the bar so high that people don't see themselves in it anymore. You've noticed I haven't used the word exercise, really. I use the word activity. When most people hear the word exercise, over 90% imagine a gym, they imagine a jock, and they don't see themselves in it, and they tune out. But when I use activity, and how are you going to integrate activity into your day, suddenly people begin to say, you know what, I can do some things that will actually promote my health, and I can do them in ways that aren't very obtrusive. So I emphasize small changes over time. So where possible, it's water instead of sugary beverages. My own story, I like Diet Coke. I was drinking 4 cans of Diet Coke a day. Now I drink 3 bottles of water a day and 1 can of Diet Coke, but I'm not out telling you no sugary carbonated beverages, because that's not human. And most people, when they hear 0, they say, not for me. Well, guess what? You can take what you're doing and shave it, and you might be surprised at the result that you get. Substitute fresh from Florida fruits and vegetables for breakfast and lunch. Instead of the bowl of instead of the bowl of processed carbohydrate in the morning, have a Florida orange, which when eaten peeled is a wonderful source of nutrition. Don't forget our state drink, which in portion is also a wonderful source of nutrition. For lunch, instead of chips, carrots and celery give you a crunch, and this starts adding up to healthier lifestyle, healthier weight. And for activity, where possible, take the stairs instead of the elevator. You burn a lot of energy with repetitive motion on stairs. And in the Department of Health, all of our stairways emphasize, and elevator congregation places emphasize the importance of, look, take the stairs, it's going to be better for you, and we have to set the example. So water, fresh from Florida fruits and vegetables, and take the stairs instead of the elevator, and you're on your way to better health. People need ways to remember, and they also need ways to remember that include a scorecard. How many are familiar with 95210 as a model out there for messaging? I think it's important in the workplace that there be some sort of consistent messaging that brings together all the healthy work habits. This is one that has gained some traction in parts of our state, and you can vary it. There's not one size that fits all. You need hours of sleep at night. For adolescents, it's 9. For adults, it's at least 7. 5 servings of fruits and vegetables, less than 2 hours of screen time, 1 hour of physical activity, and no tobacco. Some people give pushback about the 1 hour of physical activity. I'm just too busy, etc. Well, one, if you integrate it into your day, you'd be surprised where you end up. But two, how many hours does the average American adult spend in front of the TV? Not just computer and TV, but the TV a day. How many hours? Guess. All right, you're on target. 4.5 hours. So my idea is, gosh, could you spare 30 to 60 minutes in front of the TV and maybe do something active? Set the example for your spouse, set the example for your kids, for your community. You see, we have the solutions out there. We need to think differently about how we're going to get there. There are many pieces to the puzzle for weight. There's not one big puzzle piece that once we solve it, it all goes away. So Healthiest Weight Florida is about doing everything all at once, reshaping 5 environments with partners simultaneously. We're doing this by making healthy weight a team sport. Let's engage each other. Let's support each other. It doesn't take away from the reality that Weight Challenge has individual responsibility associated with it. But as I shared with you, something's happened to our environments. Our environments are making unhealthy choices too easy. If we reshape our environments as a team, watch out. Competition works. Again, think about the Super Bowl. Suppose at the end, the conclusion was, it was just a good game. Just a good game? I mean, where's the competition in that? Same thing when it comes to healthy weight. So we've got 3 programs now in the state. One, we're competing with county leadership, all 67 counties, doing a virtual walk across Florida, 2,000 miles, touching every county and logging in on a daily basis. We'll have the results in May and then share this product across the state, public domain. Please use it as you will to get competition going. We're recognizing communities that have programs and policies in place that support nutrition and activity. They're checklists. We're going to recognize those programs across Florida's 67 counties and 412 municipalities, and we wrap up the initial application process the end of February. And we're putting a spotlight on the workplace that's received recognitions already. There are over 400 businesses that have been recognized by an external group. We're going to piggyback on that and just put an additional spotlight on those businesses to say, you've got it right, and why don't we share this with other businesses in the community through recognition of worksite wellness. You know, ultimately, if you don't measure something, you're not going to succeed. And we have to understand that the scale is an important part of how we're going to achieve healthiest weight success as individuals, families, organizations, communities, counties, and across our state. We are using the body mass index as the measure. You see it listed here. It indexes weight to height, and these are the indicators of overweight and obese. While we realize that there are likely emerging some better measures, we had to start somewhere. This is what we're using, and it takes nothing away from the bodybuilders. I often get pushback saying this doesn't apply to the muscle people, and my response is, I wish that was the problem. I would be happy to have 2/3 of Floridians who have apparent weight challenge by BMI because they've got too much muscle. That is not the reality. We have weight challenge because we have too much flab. We set some pretty big goals for the state, and I am reminded of what Michelangelo shared. The greater danger for most of us lies not in setting our aim too high and falling short, but in setting our aim too low and achieving our mark. Our twin goals, we want to bend the weight curve in Florida by 5% over the next 4 years. That is an audacious goal by any standard, and it doesn't even mean we'll get to the top, to the peak of our weight challenge, but at least we're moving in the right direction. And we want to move from being the number 19 healthiest weight state to being number 1, numero uno, something we know a great deal about in this state when it comes to sports and a whole host of other activities. Well, how are we doing? I'm heartened that over the course of the past 12 to 18 months, we've seen some dramatic changes. We've seen an increase in healthiest weight people by 1.4%. When we started this, we were at 35%. Now we're at 36.4%. And to put that into context, that's 225,000 people. That's larger than Hollywood. That's larger than Fort Lauderdale. That is the size of Alachua County, home of the University of Florida. I mean, this is about real people and real differences. And when you start thinking about weight this way, there's an energy that develops that adds to even greater results across the state. And we've moved from being number 19 to number 12 as healthiest weight state. We're going to beat Colorado, which currently occupies the number 1 spot. Fundamentally, when you think about healthy weight and healthy Floridians, we can talk about the population, we can talk about the costs, but it's really about the impact on individual Floridians. It's about more birthdays and more graduations and more anniversaries. Isn't that what really matters in the end? That's what Healthiest Weight Florida is truly about. Peter Drucker articulates the best way to predict your future is to create it. And the Florida Department of Health next month is celebrating 125 years of service to the people of Florida. We are celebrating the founding of our ancestor, the State Board of Health, founded in the setting of a yellow fever epidemic in Jacksonville. The last time the people of Florida heard about a yellow fever epidemic was 1905. That means nobody in this room has heard about yellow fever epidemics in Florida. Well, we face new challenges. We face this challenge of weight, which is our top public health threat, and we face the usual challenges to include flu. That's my opportunity to remind you that if you've not gotten the flu shot yet this season, there is still time. And I would urge you to do that. I would urge your family members to get the flu shot. And please bring that back into your organizations as well. In summary, weight is the number 1 public health issue that we face in our state, and we can address this together by shaping what's happening in schools, workplace, food and beverage, physical setting, and message environments. And Healthiest Weight in the Nation is your Florida Department of Health's answer to how together we're going to reshape these environments so that we truly inform healthy choices. There's more information on our website that you see listed there, to include messages in English, Spanish, and Creole. I think that if we actually focus on what's really driving weight challenge, we are going to see significant improvements across metrics of health, improvements in the lives of Floridians, and importantly, more affordability when it comes to health care. Thank you very much. We have a few moments for questions, and I am happy to answer any questions.
Surgeon General, I'll say something I think I saw in the governor's budget yesterday. He is funding some of your Healthiest Weight initiative. You want to tell us about that?
Well, obviously, we're very excited about the It's Your Money tax cut budget, which our governor announced this week, continuing to energize priorities that will move our economy forward and make Florida the premier destination for business, which means jobs, education, and quality of life. There is in the governor's budget authorization to spend $2 million, and I want to emphasize what that is. We are going to be seeking grants from various foundations across the state and the nation to address this issue in innovative ways, and we want the authority to spend those grant dollars. So I want to be clear, it's not general revenue, it is the authority to spend money that is given to the state on behalf of foundations. And please stay tuned, not only for our humble requests, but I think more importantly, for how you can be engaged in some of the innovative projects. Thank you.